All right, we're going to go ahead and get started. Thank you for joining us for our COVID-19 update. Today, our participants are Dr. Eric France, Chief Medical Officer for CDPHE, Dr. Emily Travanti, Director, State Public Health Laboratory for CDPHE, and Scott Sherman, Brigadier General, Colorado National Guard Director, UCC Vaccine Joint Task Force. And we're going to go ahead and start with Dr. France.
Thank you. It's good to see and hear everybody here today. Thanks for joining us. Here we are, March 18th, and things continue to look very strong when it comes to the pandemic. Over the last month, we've had a clear plateau with cases and hospitalizations. And really, since mid-November, the cases have been coming down. So that's all good news. We've been recently running between 900 and 1,200 new cases a day with up to 30,000 people being tested. I think the snowstorm slowed our numbers down a bit. Our positivity rates stay below 4%, which is great. And over the last month, we've been running about 50 to 60 new hospitalizations a day. So certainly plateaued with our numbers. And so that's very exciting. Next slide, please. We follow, of course, our hospitalizations as the key measure with the amount of pandemic cases, given that outpatient cases and testing can fluctuate by weather and by personal choice of being tested. Hospitalizations will remain true to the disease itself. And so seeing that we've had this rather flat course of hospitalizations over the last month is very encouraging. As I think about the months to come, I could imagine it either continuing low, starting to come up, or staying flat. And knowing that we have new SARS-CoV-2 variants in the state, we're paying attention to be sure that the variants themselves aren't leading to a rise in hospitalization. As I think about it, I have to balance it with our vaccination efforts. And as of today, roughly 74% of our Coloradans over the age of 65 have had at least one vaccine. And certainly over the next month, I would expect most, if not all of them, will get their second dose. So if we look forward into the second half of April, if we were indeed to see cases rising, we could also feel confident that those most at risk, people 65 and older, will have probably 85% of them vaccinated with 2 doses. So that's very encouraging. Next slide, please. As we work to really make sure everyone's vaccinated, I just wanted to highlight the importance of staying cautious and careful until each of us has been fully vaccinated. With the first dose, there is some protection. However, it's really only after a couple of weeks following the second dose that we can be assured that we have the full protection of being vaccinated. An important study was published last month from Israel, looking at the real world experience of vaccines effectiveness. And it followed almost 600,000 people who were vaccinated, and found that in the third week after the first dose, it reduced infections by about half, 46%. If you then looked again in the second week following the second dose, infections were reduced by over 90%. Asymptomatic cases too had this kind of dramatic track record. So after the first dose, the asymptomatic infection was reduced by about 30%. But again, in the week following the second dose, asymptomatic infections was reduced by 90%. If we're going to be out and about and we've had one dose, we cannot let down our guard. We need to wear our masks. We need to stay 6 feet apart, wash our hands, keep distance, because we may be infected. We may be asymptomatically infected. And really, we can start to be a little less cautious or more free in our behaviors after our second dose. And you see that in the recommendations by the CDC that now allows vaccinated persons to gather with another family of vaccinated persons or families who are at low risk for vaccination. I know we'll be having new recommendations in the coming weeks from the CDC to provide guidance about how we can even open them more as a greater population becomes vaccinated. With that, I'm going to turn it over to Dr. Emily Travanti to talk a little bit about the variant that we're seeing in Colorado.
Thank you, Dr. France. As COVID-19 continues to remain spreading within our community, there continues to be an opportunity for the virus to mutate and change. We're tracking the changes in the COVID-19 genome through sequencing, and this gives us a picture of the variants that are circulating. There are two main categories of variants that we are tracking here in Colorado: variants of concern and variants under investigation. A variant of concern is a variant for which there is evidence of an increase in transmissibility, more severe disease as measured by increased hospitalizations or deaths, or evidence of decreased effectiveness of treatments or vaccines and diagnostic failures. The variants of concern that we are currently tracking in Colorado include the B1427, B1429 variant, which is formerly called L452R or Cal20. And we currently have detected 225 of that variant. The second variant that we're tracking right now in Colorado is the B117 variant that was first detected in the UK. You may recall that this was the first US variant case that we found here in Colorado at the end of December through some work done here at the State Public Health Laboratory. The other variant of concern that we're currently tracking in Colorado is the B1351 variant, which was first described in South Africa. We currently have 11 of those cases in Colorado. I would like to point out that these numbers are preliminary and will be formally updated on the state's website on Friday. A variant of under investigation, also called a variant of interest, is a variant with specific gene markers that have been associated with changes to key parts of the virus structure that may impact how it interacts with our cells, such as the receptor binding or antibody effectiveness. These variants may be associated with clusters of infection or show increased regional prevalence, but have not yet become widespread enough or shown significant enough impact on people to rise to the level of variant of concern. We're currently tracking two variants under investigation here in Colorado. We have seen 9 of the B1526 and 2 of the B2 variant. Please be careful not to confuse the B1.2 variant with the P1 variant of concern from Brazil, which we have not detected in Colorado at this point. Colorado is tracking the total number of variants of concern and variants under investigation and providing updates on Tuesdays and Fridays. The data is displayed on the Colorado COVID-19 data webpage. And the specific variants are also tracked and displayed by county. The numbers displayed on today's slide are preliminary and may change prior to tomorrow's website update. The geographic distribution of variants in Colorado shows that where we find people is where we find variants, with cases being detected in the Front Range and in our mountain communities. There are additional variants of concern, such as P1, and variants of interest, such as B152, circulating in the US and worldwide, but they have not yet been identified in Colorado. The State Public Health Laboratory continues to perform sequencing on COVID-19 positive samples. Approximately 20% of the samples being sequenced have been found to be variants. We sequenced over 550 samples last week and continue to scale up the numbers towards our goal of sequencing 5% of all positive cases in Colorado. When combined with sequencing of positive samples from Colorado at both the CDC and within private laboratories, this leads to a better understanding of the levels of variants transmission within our communities. We know the best way to control COVID-19 spread is by following public health guidance for social distancing and mask wearing, and these measures also work to control the spread of the variants. In some cases, public health guidance may include longer quarantine or isolation times when variants of concern are suspected. Vaccination is an essential tool in controlling COVID-19 as well. And while there is some evidence that vaccines may be less effective against variants of concern, we know that the currently authorized vaccines available will still produce an effective immune response against these variants that are currently circulating in Colorado. And we urge everyone to get vaccinated when it's your turn. At this point, I'd like to turn them over to General Sherman to give more updates on vaccines in Colorado.
Hey, thanks, Dr. Travanti. Hey, good afternoon, everyone. Today, I'm just going to give you an update on the impact of the recent weather, current and future vaccine supply, and the community vaccination sites. We were fortunate to receive all 325,600 doses last week before the weather hit. Those 325,000 doses included over 233,000 for the state allocation, over 10,600 doses for the federal qualified health clinics through the federal program, almost 70,000 doses to our pharmacies through the federal retail pharmacy program, and 12,500 doses to the VA, the Department of Defense, Bureau of Prisons, and Indian Health Service. Due to the weather and delays at DIA on Monday, the CDC held all shipments for this week until Tuesday. So we started receiving those shipments then. So far, total doses received in the state is 324,910 doses, and that includes the federal program allocation too. The state received a little over 250,000 doses. The federally qualified health clinics received 2,900 doses so far. Pharmacies received almost 60,000 doses from the federal retail pharmacy program, and the federal entities, which is the Veterans Administration, DOD, Bureau of Prisons, Indian Health Service, they've received 12,120 doses so far this week. Next week, the Colorado state allocation, just the state, not the federal programs, is 254,420 doses. And we're going to put almost 28,000 doses of that allocation towards the community vaccination sites. Currently, we're still expecting that the Johnson & Johnson vaccine allocation will increase the week of 28 March. The CDC is telling us that there are about 4 million doses available for the entire US, with Colorado's share being around 60,000 doses. We're also being told that the weekly Johnson & Johnson allocation is supposed to increase to 6 million doses per week nationally later in April, which will result in Colorado receiving around 90,000 doses. The CDC is also telling us that in April, the Pfizer and Moderna allocations will start to increase by 1 million doses per week nationally, which for Colorado, that'll mean an increase of 16,000 doses every week of Moderna and Pfizer. Now, for the community vaccination sites, as you're all aware, the state community vaccination sites in Mesa County at the Grand Junction Convention Center and in El Paso County at the Broadmoor World Arena opened yesterday. The Adams County site at Dick's Sporting Goods Park and in Pueblo at the State Fairgrounds are scheduled to open on the 22nd. The Larimer County site at the ranch is scheduled to open the 24th. And the Ball Arena in Denver is scheduled to open around April 1st. We designed these sites to have the capability to administer 6,000 doses per day, and it is certainly our plan to ramp up these sites and operate them 6 days per week as the vaccination supply increases and as we transition into phase 2 in the general population. So with that, I'll pass it back to Heidi for questions.
Great, thank you, all of you. And so we'll go ahead and move to our Q&A portion. We use the raise hand function. So for members of the media, if you want to go ahead and do that, then I will call on you. And if you could say which outlet you're with and your name, that would be great. And Anusha, we're going to go ahead and start with you.
Hey, this is Anusha with 9 News. I had a 2-part question. I just wanted to clarify ahead of 1B4 opening up tomorrow. Will there be any kind of weighted system or priority given within the phase for essential workers versus people with health risks? And are there also any stats about the number of doses that have had to be thrown away or wasted at this point? And what were the circumstances around that?
I will start. We don't have any formal prioritization within 1B4. However, I think you'll see the healthcare systems and vaccine administrators are working through lists. And so there'll be folks who will be first on that list and people who will be in subsequent positions after. So that may lead to a certain prioritization, but otherwise, I don't think we have any specific state level plans for prioritization within 1B4. And regarding the waste question, I'll ask Brigadier General Sherman if he has any.
Yeah, I think, Anusha, the only thing we've had is we had 2 trays of Pfizer to Banner Health. That's 2,340 doses that we had to actually send back. They had a temperature variance on their tracker that was brought in, so we actually had to ship those back to the CDC, and they were replaced. But besides that, there haven't been any wasted dosage in the state that has been reported.
Thank you.
If I could for a minute, Heidi, I want to just do a little more clarifying around the variant experience in Colorado.
Yes, please.
Yes, so as you heard Dr. Travanti describe, we have a surveillance program. So a surveillance program is taking a sample of all of the tests and then running genome sequencing. The results of that sample, if done correctly, should reflect the true experience across the state. So what have we found? We found that in this sample, about 22% of all the viruses tested were of the B1427 and 1429 variants, the California variants as it's been called. So that would have me conclude that around 20 to 25% of all SARS-CoV-2 infections happening in Colorado now are of this variant. The other variant, B117, was found in about 8% in the sample. So again, about 8% of all SARS-CoV-2 infections in the state might be explained by the B117 variant. So between the two of them, that's about 30% of all of our Colorado infections are explained by one of these 2 variants. And so we'll be tracking that going forward. We know that B1427 and 1429 is considered a variant of concern because it's thought to be more transmissible, maybe as much as 20% more transmissible, and it may be able to hide from the immune system. We're still learning more about this variant from studies that are happening in California, where over half of all infections are caused by this variant. Thank you.
Great, thank you. And so, okay, so before we go on to the other questions, this is my fault. I should have said this when we got started. If you have a question that is outside of what we talked about today, please go ahead and send that over to media_info@state.co.us. And then I'm going to do the best I can to get through all of your first questions. If you have some follow-up, we'll have you jump right back in line, and I'll try and get to those at the end. And then if you're having any concern with your raise hand function, go ahead and chat Ben, and he'll help you work through it, or we'll do the best we can to get you in. And so with that, John, Frank, I'm going to take it to you.
Thanks so much for taking the time. You mentioned the vaccine locations just a moment ago. The locations for the first 2 sites, were they targeted to address vaccine hesitancy among Republicans, given that those 2 counties have large conservative populations? And can you share more details about why you picked those 2 locations instead of maybe some counties that have received below their fair share of vaccines?
Yeah, the locations were just locations that also work regionally, that have the space to conduct a vaccination site to do 6,000 doses per day, that have the available room to do that, and the resources, and certainly the population density to handle that, and also, population centers that are in a certain location or certain area, whether it be Western Slope or Front Range, that are major population centers. That was the only thing we took into consideration on choosing those sites. And of course, the counties and the providers' ability to help out at those sites, which are so critical.
Great, thank you. Seth, we'll go over to you.
Hi, thanks. Seth from the Gazette in Colorado Springs and Denver. Dr. France, you mentioned, potentially getting more guidance from CDC to loosen things up. Can you expand on that at all? What specifically may they be looking at loosening up? And do you see a world in which masking can be loosened prior to that order being completely removed? I mean, is it a binary thing, or is there shades of gray in between? Thank you.
Dr. France, you're muted.
Here I've been going on, and apparently I've been muted, so my apologies there. So I was speaking about how the CDC guidance I expect to come because everybody's asking for it. I don't know when it would come or its content, but clearly as more people are vaccinated, the CDC will be helping us determine under what situations might we not be wearing masks. And so we're listening and waiting to hear more. We've learned a few things, as I pointed out before, that you can gather with another family in your home without wearing a mask. At the same time, we know that CMS during residential care facility visits wants you to wear a mask. So I think it'll be varying as we go forward. And I'm sorry, what was the second part of your question?
Sure. Just whether there's gray area between the mask order we have now and removing it fully, if you see a world where it might be modified in some way without it being lifted fully at some point in the next few months.
Yeah, thank you. I think what's going to happen is that we have to think about it at two levels. And so on one level, it's the population level, and what can we do? Where do we need to wear a mask? Where can we start loosening up and letting people gather in safe settings without a mask because a lot of people are vaccinated? And then there's the individual level. So I've been vaccinated. I go to the grocery store. Am I going to wear a mask or not wear a mask in some future time when maybe masks aren't required? I might choose to still wear a mask because I have somebody at home who hasn't been vaccinated, or somebody who might be at higher risk of complications should they get sick. So there'll be individual decisions about personal risk as well as the community level risk. And my point here is that even as we open things up, each of us will have to make decisions about what we're comfortable for and how much of a hassle wearing a mask is versus the potential benefit to the individual or the family members of that individual.
Thank you.
Great, thank you. Evan, we're going to go to you.
Thanks. I have been watching for the past 2 weeks as the deaths due to COVID have outnumbered deaths among COVID cases. This is the first time that that's happened that I can tell. What explains this?
I haven't looked at it directly. I would imagine it may be the delay because deaths due to COVID is coming off of a death certificate, where deaths among persons with COVID may be coming from another source, hospital source, for instance. And so deaths due to COVID require us to receive that on the death certificate, and that itself can take some time. So it might just be a temporary discontinuation between the two. That might explain it, but we'd have to look at that more.
But just to be clear, there was, the deaths due to COVID was always below the number of deaths among COVID cases. And that kind of shrank and shrank and shrank And if you look over time, you can see that a lot of these, it looks like they are being backfilled, or, you know, it's a retroactive designation. But I just don't understand how we can have more of deaths due versus deaths among. But if you can maybe get me an answer over email, that would be great. I appreciate it.
Yeah, Evan, absolutely. We will get you something from Media Info. Thank you for the question.
Thanks.
All right, we're going to go to Addie.
Hi there, this is Addie with Denver 7. Thank you so much for taking your time to answer all of our questions. There's a lot of misinformation out there. So I wanted to address some women health concerns. Have we learned any new information on the impacts of the vaccine and pregnancy and fertility? And then I also wanted to follow up with a question on, do we know if this will, like any of these 3 vaccines are going to have any issues with women who want to have children in the future that are in their 20s or 30s?
I can't really add anything new. There's been this story around sterility that hasn't been based on any science, and there's nothing new to add given the absence of science. And regarding pregnancy, we'll gather more information as more pregnant women are vaccinated, and I haven't seen anything at this point. Sorry, I can't give you more at this point.
Yeah, I mean, in the meantime, if you're pregnant, obviously there's a lot of reports out there. Is there anything or anyone you should be talking to make the best decision for yourself?
We always recommend, of course, to speak with your physician. Pregnant woman speaking to her obstetrician gynecologist is likely to get the best, most up-to-date information on what we know around the safety and effectiveness among pregnant women. To date, I think, again, we haven't seen any risk for vaccinating pregnant women. We do have an FAQ on this on our website, and there's one on the CDC if you want to look there for some info.
Yeah, thank you so much. Did you want to address any misinformation, since we have you on here right now, about pregnancy and the vaccines and fertility?
I think, as we've always said, there's no association between infertility problems with this vaccine. So it's not there. I'm sorry that that's a story that's out there. Hopefully over time, it will disappear as a rumor, as rumors can do over time.
Great, thank you. Chris, we're going to go ahead and go over to you.
Chris Vanderveen with 9 News. Question about some of the data trends that have happened just within the last week or so. Cases have certainly dropped probably in the last few days as a result of extremely low testing numbers, but hospitalizations in particular have proven stubborn over the last week or so. In fact, they're rising a little bit. Does anybody have any thoughts as to why that might be the case, specific to that sort of, and this also follows a sort of a prolonged period of not a sharp decrease in hospitalizations. Does anybody have any thoughts as to what might be going on? Are the variants in play here, or what might be causing that sort of lack of significant decrease in hospitalization?
No, I don't think we have any specific insight as to why this might be that we have this persistence. And I could imagine it might be a combination of factors. In some ways, though, I'm making that up, and that's really about the complexity of this. On the one hand, we've opened up things a bit to improve the economy. On the other hand, we've been vaccinating a large proportion of people most at risk for hospitalizations. When you mix these different variables together, the end result is this flat hospitalization rate. And to try and tease out what specifically explains it is really beyond us at this point.
Great, thank you. And Meg, I'm going to jump into you. Can you hear us?
Yes.
Perfect.
All right. Thank you. I just wanted to clarify for the pace of vaccinations with the additional doses that we're expecting. Does that change anything for getting to the general population, maybe late April or May?
Yeah, it's going to come into consideration. That'll be a consideration that the governor takes, and certainly his staff, all of us will be taking into account. It's also how many really focused on getting 60 and above vaccinated. So once we reach a number there, it's really the most vulnerable populations getting a really good large part of our critical essential frontline workers, getting them vaccinated. That's certainly the goal there before we start to consider to go into phase 2.
Great, thank you. And then I'm just seeing Morrow. So if you could say your first and last name and which outlet you're with.
Hi, it's Matt Morrow with Fox in Denver. Quick question about the vaccines. Have you seen anyone who has gotten sick after getting the vaccine, sick with COVID that is, or has potentially passed it on to anyone else? Thank you.
As you know, the vaccines themselves are considered 90 to 95% effective. And so there is a small percent of people who will be vaccinated and then have the risk of being reinfected and will become reinfected. And we are trying to gather information on those cases, but I haven't heard anything specific about them. It's more like, yeah, that can happen. You hear the story, a colleague or a friend was vaccinated, and then some weeks later actually got COVID. And it's disappointing, and it's also expected given that the vaccine efficacy is not 100%.
Great, thank you. Virginia, if you could say what outlet you're with.
Thank you. I'm Virginia Garcia-Pivic, freelance reporter for Hispanic media outlets. Hi, Dr. Franz. Nice to see you again. My question is, how does the response of minorities of color compare to the Anglo population? There's been a few concerns among the Latino leaders regarding the no ID required portion, but then when they get to sites, they're being requested the ID. And that may be a factor for Latino populations, for example, to feel like not invited to vaccine clinics. Thank you.
Well, I think we have new information showing that vaccine acceptance in general is higher than it was in the fall. I'm not surprised. That's the typical trajectory of any new vaccine introduced in the last 25 years, where there may be some caution to begin with, but within 6 to 12 months, vaccine acceptance goes higher, and that acceptance has been seen across race ethnicity groups. So that's encouraging, and I expect it to continue to rise as the vaccination is normalized, as people know people who were vaccinated and who were protected by the vaccine. So that's good. I think too, there is a little requesting of identification at some of the vaccine sites. It's not required, of course, so anybody could say, I don't have my ID, I'm not showing you an ID today, it's not required. So, and it may be that they're asking for it simply for their tracking purposes of vaccination registry systems. Thank you.
Great, thank you. And with that, we are out of time. So if we did not get a chance to get to your question, please go ahead and send that over to media_info@state.co.us. And I want to thank you all for joining us. I also want to thank our participants and our interpreters. And I hope you guys have a lovely afternoon. Thank you.